Welcome to the American Shoulder and Elbow Surgeons Podcast. I'm your host, Peter Chalmers, a shoulder and elbow surgeon at the University of Utah in Salt Lake City, and I'm joined today by my co-host, Rachel Frank, a sports and shoulder surgeon at the University of Colorado in Denver. Rachel, how are you?
I'm doing great. How are you, Pete?
Oh, I'm doing great. Before we get started, I should mention the views expressed in this podcast do not necessarily reflect the views of the American Shoulder and Elbow Surgeons Society, the University of Utah, the University of Colorado, or the institutions of any of our guests. Okay, today we have an episode for you on a topic that will be relevant to all of our listeners, but in particular our young listeners, people that are still in their training. And our topic here is how to pick a fellowship. Now, fellowship is often described as the best year ever. Certainly for me, it was one of the highest impact years when I learned the most. When it comes to training, it's a critical topic for trainees to figure out how do you pick the best fellowship. And many of our seasoned listeners are fellowship faculty. It's important for them to know what are today's applicants looking for. And it's probably a little bit different in 2023 than it was 5, 10, 15, 20 years ago. So we've invited a couple of guests, 2 fellowship directors, 1 current fellow. So first we have Dr. Michael Amini, who's the chief of the Shoulder Division of the Core Institute in Phoenix, Arizona. Michael, welcome to the podcast.
Thanks for having me. I appreciate the invitation.
Next, we have Dr. Andy Jensen, shoulder and elbow surgeon at UCLA in California. Andy, welcome. Thanks for joining us.
Thanks for having me.
All right, and then finally we have Dr. Ryan Hill, who's currently a shoulder and elbow fellow at WashU in St. Louis. Ryan, welcome to the podcast.
Thanks for having me, guys. Happy to be here.
All right. Well, thank you all for joining. Let's get started with what everyone wants to know. As an applicant, what do you look for when applying to fellowship? Ryan, let's start with you.
Well, I think there's obviously a lot of different criteria that we can go over. I think probably the most important thing to start is that fellowship is a different decision than a lot of the decisions that have been made along the path that everybody who's listening to this podcast is on. And I think it's different in the sense that it really needs to be tailored to the applicant themselves, being honest, being introspective, and kind of knowing who they are as an adult learner and what their goals are. And that may not necessarily mean the fellowship that's the most, has the biggest name or the most highly acclaimed. It may be, it may not be. So I think the biggest criterion that I would recommend is that people really have to be honest with themselves and where they think they're going to get the best training for their way of learning and for their future career. And one of the really important things with that is the people in that fellowship where they would potentially be going. You hear people talk about you can do anything for a year, which is true, but fellowship is really only the first in kind of building a foundation for a very long-term relationship with mentors who will continue to influence your career trajectory, and who, especially in your first years out of fellowship, will be people that you can reach out to for advice and for things like that. And I think that also goes with, kind of having it be somewhat a fit for each individual person, because different fellowships have different cultures and different ways of doing things that may or may not be the best fit for any given applicant. I'm sure we'll get into some of the other more objective criteria, but I think that that's an important thing to start with.
Let's flip the script a little bit. So, Michael and Andy, what do you guys look at in terms of the types of fellows you hope to recruit? What are you looking for on the other side of things? Let's start with Michael first.
Yeah, so I think each program has a very unique culture, a very unique sort of flavor in terms of not just the personalities that make up the faculty for that program, but also the things that you're going to see, what your year is structured like. Is it a very one-on-one or one-on-two kind of mentality, or is it, you're working with 10 different faculty members? And, it really, every program is very unique in that regard. And so it's very, very much about the personal fit, both with the personalities in some sense, because it's a much more intimate relationship than it is in residency. We have 2 hands and upper extremity fellows here with us. Now, granted, we've got maybe a dozen faculty members, but nonetheless, it's much more intimate than having 20 or 40 or 50 residents around, and you work a lot more closely with them. It's at a higher level of education, higher level of discussion. There are people that, to Ryan's point, you talk to for years afterwards when they get on to practice and tell them about they ask you about what you would do, and sometimes you ask them what they would do when they get far enough out that you want to know their opinion. So it's the fit of the personalities, but also the fit of what they want to see. And in some sense, it's a very honest question and a very honest answer for most people. What are you looking for in a fellowship? And if they tell you, and it's not really the flavor of the program, you kindly tell them, well, this is the flavor of the program, and maybe this isn't kind of the right thing for you, and that's okay. It's not like residency where everybody's just sort of just looking for a spot. Now, granted, you want the best spot, but it's much more personal, much more intimate, much more like, I want this. Is this the right fit for me, for my education, and for the people I'm going to be with for a year?
Andy, let me ask you, when you're looking at applicants, in addition to what Michael just mentioned, when you have a lot of applicants, few spots, so you have to narrow it down somewhere. When you're looking for that right fit, are you looking at letters of rec? Are you doing, what I tend to do during interviews or before interviews is I'll text or call people I know from the program the resident's from? Are you looking more for that word of mouth? Because everyone has a good letter of rec, and while some are better than others, there's no bad letter of rec, right? There's just there's excellent ones, and then there's the other ones, but nothing terrible. So what are you looking for specifically out of that applicant to say they're the right fit for your program?
Yeah, I mean, I agree. Getting a sense of people's personalities, I think, is really important. Just to kind of echo what Michael and Ryan have both said. I work with our PGY4 residents quite extensively here at UCLA, and I'm always telling them, whichever fellowship you go to, you're going to be really well trained when you're done. You're going to be able to be a excellent shoulder and elbow surgeon, sports surgeon. But it's mostly about fit, and I think that's a tough thing to hear sometimes, because we're all try to be generally pretty objective people and type A and don't want to necessarily just like go with our gut, quote unquote. But ultimately, I think that's the best advice, is to apply broadly, see a lot of these places, meet a lot of, if you're an applicant, meet a lot of the faculty. If you're faculty, meet all the applicants, and ultimately go with what feels right.
Now, I think one of the things that applicants should know is what are the things you really should look out for. So what are the red flags you may see, or you hear on the trail, or things that you may things you may observe on the interview day, and then what are some real like gold star, like if you see this, like that's a really good thing. What do you think, Ryan? What are some things that fall into kind of the extremes, good, bad?
I think some of the, I guess, starting with the bad, is you want to have a comprehensive training experience. And I think some of the things that can detract from that are any sense that there are large periods of the year where you go without doing essential skills. Now, obviously, every fellowship is going to have a different profile of the types of cases that you get. And some are very, very strong in certain things and maybe not so strong in other things. But I think if there's any program where you're going to go without basic experience or basic skills for either your overall experience for the entire year or periods of months at a time where you're not doing something, as an adult learner learning a complex skill, that repetition is important. So I think any sort of experience like that, it's good to get a sense too of what the dynamic is with the faculty themselves, what they're letting the fellows do, how often the fellows are doing cases with residents, because I think that it's easy to kind of get fixated on a case number, but that number means a lot different things at different programs, depending on what that actual experience is. So I think those are two things to pay attention to. In terms of gold star things, I guess you could say kind of the flip side of those types of things. But I think the gold star things are things that talking to the current fellows can be helpful for, because that's when you really find out what the true experience is like. But I think having the opportunity to do some sort of autonomous activities as a fellow is important, whether that's taking call, that could be even just general trauma call, or in your shoulder elbow experiences. I think that's very important, and getting that before you get out into the world. I think the relationship between the faculty members and the fellows, that they are mentors and supportive, and that there's a good relationship there. You don't have to love all the people that teach you, but if you're choosing to spend a year somewhere, you want to have a good experience, and that's only going to augment your learning. And I think that, if there are opportunities for proactive learning, like a cadaver lab or other things like that, those aren't necessarily like, one of the maybe focal points or essential things, but those can really augment all of the learning that you're doing clinically, and really help you hone in on some of the things that either you don't see as much, or that you may not feel as comfortable with, or feel like you need more work on.
What do you think, Michael? Anything else you'd add? Any other red flags, gold star kind of things when you think about fellowships, or as you advise residents that work with you?
Yeah, I think you spend 5 years working very hard, very long hours, trying to learn, trying to take care of patients, trying to develop skills. And when it came to education, when it came to fellowship, I really, really wanted it to be about the education, meaning that there were some programs that the fellows were almost used to a resident level of work, if that makes sense. To use an old phrase, right? They were scut monkeys. And that was very much a big turnoff for me. Even if it was a good education otherwise, I wanted to spend my time learning as much as I could in a very, very short year in a complex field, right? I mean, everything we subspecialize in is far more complex than you ever realize before you get into it. And so it's a very finite amount of time. And I didn't want to be there filling out FMLA paperwork 2 hours after my attending went home from clinic at 7 p.m. and I go home at 9. That just wasn't the kind of place that I wanted to be. I still was busy in my fellowship. I did my shoulder elbow fellowship at the Cleveland Clinic, and it's not like we had easy hours or anything like that, but my time was very educationally based. There were conferences, there were clinics, there was, operating days of my attendings, and I wasn't there to move their practice along, if that makes sense. I was there to learn from my education. And so that big principle, I think, has really resonated even with how we sort of treat our fellows here. Like, my practice runs with or without my fellows present. In fact, they're really only with me a handful of months of the year. So the other 2/3 of the year, then I'm fellowless. So I wanted a program like that. That's kind of how I want my time with my fellows to be now. And that was really important to me. And then the rest of it really came down to the things that I wanted to see. I really wanted to focus on shoulder arthroplasty, not just that, but that's where I really wanted to really sort of, if I ever had to say, this is the one thing I'm going to do forever, that was it. And my program was much sort of heavier in that. And I was really thrilled with the people I was able to train with in that regard. And I still got a good education broadly in shoulder and elbow, but I really sought out what I was looking for in that regard from a clinical perspective, what I wanted to do long term.
What about you, Andy? Anything else to add?
Yeah, I'd say one of the pieces of advice I give to our fours is to prioritize complexity over volume. You're gonna get, when you're out in practice, many reps are doing a primary cuff or a primary shoulder arthroplasty, for instance, but you might not see, big time revisions, APCs, different scapula stuff, tendon transfers. Even if you don't want that as part of your practice long term, I think seeing that in fellowship is being done by a world leader, sort of an expert in that field, is really invaluable. So I would say, to phrase it to your question, Peter, what would be a red flag? I would say maybe not seeing like a high level of complexity would be, for me at least, I'd recommend that. That'd be a program you might want to stay away from.
Peter, can I add one more thing? Sorry, I totally agree with what Michael and Andy said. I think those are great points. One additional thing that I thought of, which I think has changed a little bit with some of the new fellowship regulations, is clinic exposure. It's the thing that nobody gets excited about, but I think in the past there were certain fellowships that did not give you much clinic exposure, and again, it's not the thing that everybody wants to go to their shoulder fellowship to learn how to do complex cases. But Peter, you gave me this advice at one point that, your clinic is really the bedrock and the foundation of your entire practice. And you could be a technically skilled surgeon, but if you're indicating the wrong patients for the wrong procedures, that's obviously not a great thing. And I think that shoulder is complicated, and it can be really challenging to figure out which patients need surgery, which don't. And then even in the post-op period, what should a cuff look like at 2-4 weeks from surgery? And you're only going to learn that in clinic. So I think that anything that would be a red flag is any experience that indicates that your clinic exposure is kind of either kicked to the wayside or not as present as it should be.
Guy, you made so many great points there about balancing clinic and the OR and the relationships. And Guy, really glad we had you guys on to talk about this. One question I wanted to ask is about the balance between complexity and volume. And is there a point at which, even if the cases are complicated enough, you're not doing enough of them? So if you went to a fellowship and they were to say, oh, we did 100 cases this year, is that a red flag? How do you balance those two things in deciding what you would want to do in terms of which fellowship you want to go to?
Yeah, certainly. I mean, something like an outlier like that would be concerning for sure. But one of the panelists, Michael Ryan, already said this, I think. But so the quality of the case, I always think is more important than strictly the volume number. So if it's 300, 350, 400, 500, as the most important thing is the quality of the case. And you don't want to be double scrubbing. You want to be with someone who's actively teaching, who's sort of a dedicated teacher who wants you to kind of graduate autonomy, eventually take over the kind of the role of the lead surgeon. So yes, there are probably some outliers, but in my sense is that none of the fellowships that are out there have that low in numbers. It's more about the quality of the reps, I think.
It's funny you guys mention this in terms of the clinic experience, because that's never, as you mentioned, Ryan, right away, that's never the most exciting part. That's not, you don't want to go on an interview and be like, this clinic is awesome, I'm so excited to come here. But when I think back to my fellowship, and I did sports, but with a heavy shoulder exposure, the clinic part is probably what helped me the most in my first year. But that was also complemented by the reps. So the high volume also made it more familiar in that first year to do cases, and it wasn't a case the first time. I will tell you, and as I help with our fellowship from a training perspective, the feedback I get, and maybe the fellows just don't like the OR, but the comments we get are that the clinic is, for their experience with me, one of the best they have all year. And simply due to the fact that it's so busy, we see so many patients, they're actively involved in the decision making, and they see the pre-op, they see the immediate post-op, and then they see the 2 or 3 month follow-up. And then when they rotate back on, they get to see 6 and 8 and 9 month follow-up. And it's important, especially for our young listeners out there, to understand you need to know what a cuff should look like at 4 weeks and at 8 weeks. And you need to know when you might need to consider an injection or taking them back to the OR. You need to know more of the complications than anything else. And that really only comes from a clinic. So I would echo that for our young listeners out there, pay attention to the clinic exposure in addition to the reps. One thing I want to ask you guys, and this often brings up a visceral response, especially amongst our more seasoned listeners and people who have been in the field for 10, 20 years, et cetera, but the role of social media in picking a fellowship program. Here in 2022, 2023, it's huge for med schools, for residencies, for fellowships. It's how, especially in the era of COVID with virtual interviews and virtual exposures to programs, they really get a taste for the program, be it accurate or not accurate, via social media. So Ryan, tell us, did social media and what programs put online have anything to do with you selecting your fellowship? And how would you advise applicants to look at this moving forward?
I'm probably not the most helpful person to answer that question. I'm a little bit more of an old soul. I'm not really very active on social media other than passive interpretation of information. I did not really use it at all for my fellowship application. I was involved in some of the stuff that we were doing for my residency program when I was a resident. I don't even know how aware I am of how much different shoulder programs are using it to promote their fellowships. I think it's a way to become familiar with it, but I wouldn't use it as a primary source of information or anything to like hang your decision on. But I think it is, it can give you more of the softer side of things, of maybe a little bit of a sense of what the personality of the faculty or the personality of the program might be like.
Michael, what are your thoughts when you think about, putting out things on social media, be it about your practice or the fellowship in general? Is that something you're actively doing? Do you have a system for that? And do you think it helps influence the type of applicants you're getting and ultimately matching when you think about your fellowship program?
Yeah, when I when I'm present on social media from a professional standpoint, it's not really necessarily about the fellowship. It's really just about sort of engaging the professional community. And so for whatever sort of comes about that secondarily is just sort of whatever happens in that regard. It's not necessarily to promote the fellowship. I think fellowship, at least my sense is that social media for fellowship is a little harder to do because it's so much smaller, right? We go from orthopedics, which is, I don't know, whatever the number is now, maybe 1,000 residents a year, down to every subspecialty, which is between 50 and 200 people a year in sports, or in my case, shoulder and elbow. It's a very small field, and so it's kind of hard to like have enough engagement out there and enough people who are even looking. Right, there's 50 applicants or so for shoulder and elbow. That's not many viewers to really put out a ton of effort on social media. So I don't know that it'll be as important as it seems to be becoming for residency. It seems to be becoming a bigger thing to try to show off what the culture of your residency is like. But it's because there's more to show off, right? Programs are a whole lot bigger than fellowship programs. And the audience is also much larger, right? You have hundreds and hundreds of people looking as opposed to 50 or 100 or 200.
Andy, any additional thoughts? Do you think if a program does not have a social media presence, and again, we're talking 2023 and maybe 5 years ago, different story, do you think that that's a turnoff to today's applicant? And think about the medical students and residents that you work with, and not just, the shoulder and elbow surgeons that you work with. Do you think social media is something that programs need to utilize to attract top candidates, or do you think not so much, and word of mouth is, and mentors telling their residents, this is where you got to apply, this is the best fit for you, et cetera? What do you think about it?
With the caveat that I actually don't use social media myself, so I'm kind of an old soul too, just like Ryan. But I don't think it would be the best way. I wouldn't counsel a resident to put much stake into the website of a program or the social media output of a program. I think word of mouth and going to see the place themselves, if they can, or at least over Zoom interviews, are definitely going to give you a better kind of sense of the place.
All right. Now, earlier you guys really mentioned how important relationships are. We've heard discussion of how important complexity is. Certainly one of the ways you get to that is you could work with someone who's like super famous or amazing. So one of my questions here is, what are your guys' thoughts on that? If you're an applicant and there's like one specific person you were like, this person I'm obsessed with and I really want to work with this program, should you try for that program? What if that person leaves? What if that person you don't click with because they're one single person? Like, do you think that's a good way to pick a program? Is that a bad way to pick a program? What do you think, Ryan?
I think that can certainly be a factor. I don't think it should be the one deciding factor, but it can be, depending on the person and depending on the interest, it could be, one of the main factors. I think taking a step back from that would be, again, kind of being honest and introspective, is why do you want to work with that person? Is it just because they're famous? Because if that's the reason, then that's probably not a good reason. But if the reason is they do X, Y, and Z cases, and I am incredibly interested in those, I'm going to be doing those in my practice, I want to do research on those things, then yeah, maybe that is a reason. And I think that, like you kind of implied, getting a sense of if that person's going anywhere, if they're stable in the job that they're in, is a smart thing to do as an insurance policy. But I don't think it's unreasonable to have that be a driving factor, just with kind of some self honesty and with some precautions.
Certainly, I think you and I both, made our decision to work with the world famous Jay Keener, and I don't feel bad about that decision. So I can see it being a positive, but it can be a risk. I mean, I also went to work with the world famous Dr. Lisa Gallitz, and she promptly left for Mount Sinai. So it can be a risk. It cuts both ways. What do you think, Andy? Do you think this is a good way to make the decision, a bad way?
Yeah, I think that's a big thing to consider. Going to a fellowship for one specific person is just, because of the way our fellowship application and then where it starts is laid out, it's a year and a half later. It is a big risk. So, in general, all things being equal, I think it's probably better to go somewhere that has multiple mentors that you could see yourself clicking with. That being said, in the situation like what Ryan laid out, I think that would be, totally reasonable and worthwhile endeavor to pursue.
What are your thoughts, Michael? Is this reasonable, unreasonable way to make the decision?
I love the bait you're throwing out, because I'm 100% with you on this. I think, the having variety in the faculty. I mean, it's almost like going to play college basketball because of the coach, right? And there's musical chairs all the time. People are moving, and you go there, and then all of a sudden you're left, thinking like, do I still want to be here? So that was really, really important for me when I was looking at fellowship programs, was variety of faculty, not just like the sheer number, but also just variety amongst the things people did and where they trained, where they came from, was really important to me. Maybe even among the top one or two things that I was looking at, aside from like the things that they actually did, the actual education that I would get there. But that was a very, very important thing for me when I was looking at programs. If it was just a one-on-one 12-month relationship, even if I really thought highly of that person, it was a bit of a turnoff for this exact reason.
All right, let me ask you guys a somewhat similar question, but also not at all similar. So I'll just put it with that. When applicants are looking at fellowships, one of the things they're often thinking about is jobs, their future job. And so what would you advise the applicant in terms of looking at their fellowship as a job opportunity? If they want to work in the city that fellowship happens to be in, should they go to that fellowship? Should they go to a different fellowship to avoid potential future competition if they're not going to get hired at the place of their current fellowship? How would you advise them? Because I think this is a common source of anxiety for fellowship applicants. It's something, there's even rumors of programs having quote unquote non-competes when you sign a fellowship contract, which to my understanding is actually not a thing, but correct me if I'm wrong if you guys actually know of that. A lot of rumors. I haven't heard of anything actually being implemented with that. But it causes a lot of anxiety, and a lot of people might want to do a fellowship, say here at the University of Colorado, because they're dead set on working in Denver and Boulder. But sometimes fellowship faculty don't want to train their competition. And so if there's no room to hire a partner, that can be a little bit challenging. So what would you say, Michael? Let's start with you on that. What are your thoughts on this topic?
Yeah, it's so different depending on the environment of where that program is. I think, like for us, we've had some fellows. In fact, one of ours is probably going to stay in town, but not with our group next year. But our city is also big enough and, relatively speaking, still underserved enough, despite how big Phoenix is, that it's okay. It doesn't give us anxiety to even think about that. Like that's good for him. If he's happy here, he wants to stay here. If that works out, great. But in different, cities, it can be much more saturated. And so the thought of having one of your trainees who you just taught all your tricks to then go, work a half mile down the road could potentially turn them off from even wanting to take you, right? If Phoenix was that way, where we were super saturated and really heavily competing against each other that way, if somebody told me they want to be in Phoenix long term, I could see how I would be turned off by that. So I don't know that there's a way to know that without actually finding out. By the time you find out, you've already kind of played your cards. I would almost just stay away from the topic as long as you can help it. I think not wanting to be in that city could not wouldn't harm you, right? Like if somebody interviewed with us and said, I don't want to stay in Phoenix, that's never going to hurt them, right? But potentially that's a little bit of a risk. If you tell a program, I want to go here and actually want to stay here, then there is a potential risk there.
Andy, what are your thoughts? Saturated market in LA. You have the next applicant who's the next superstar that you want to recruit. You want to be part of their training. You'd love to hire them on, but you don't have room for a partner. And they tell you, as soon as they match, awesome, I'm taking a job, half mile down the road, and I'm gonna do everything you do. I'm just gonna do it newer and better because I'm younger and more trained and blah blah blah. What do you say, or how do you approach that?
Also, I'm not so sure. I haven't really considered that situation before. I mean, my background is I did my residency at UCLA. I kind of had a good sense I was coming back on faculty, and I did my fellowship up at Mayo, so it wasn't really a thing for me. I think I like Michael's advice. I would just as an applicant, if I was advising that that applicant you just laid out, I would just say, maybe read the tea leaves, but otherwise keep it to yourself and kind of see how it all goes. I do think this non-compete thing, I too, Rachel, don't have any like firm evidence of that. I've heard rumors as well. I would maybe suss that out ahead of time, but otherwise keep everything to yourself, I suppose.
Ryan, let me ask you, did this, you're the closest to interviews, even though you did it a couple of years ago. Did this kind of thing come up where people would say, where are you hoping to practice, or where do you want to end up, et cetera? And did it ever create a sense of awkwardness in terms of the actual interview? And was it something you looked at when you were applying to fellowships? Did you want to, and I'm not asking you if you want to, I don't know your job situation, but if you want to practice in St. Louis or what you wanted to do, was this a factor for you in deciding where to apply?
I think it's a great question. It's not something that I thought about much as an applicant, and I don't recall getting questions from a location standpoint, other than maybe just casual conversation. I can see how that could potentially be an issue, although similar to what you said and what Andy said, I've heard things about non-competes kind of being done away with kind of in all contexts. So I think that that's maybe less of an issue, but could cause some potential strain with, between a fellow and their fellowship mentors. I think that to me, consideration of location in terms of future job is maybe something that applicants shouldn't be focusing on too much, and shouldn't necessarily, like Andy said and Michael said, like bringing up in an interview. I think that some of the more important things for future job considerations are just figuring out what type of practice you want to have, what you want to be doing, because that should influence the type of fellowship that you want to go to, not necessarily where it's located. But you have to be realistic. And some people in their fourth year of residency already know where they're going, and going to the famous high powered, Ivory Tower Fellowship may not be the best thing for somebody who's going into private practice back in their hometown. So I think it's a little bit of a roundabout response to your question, but I think it's something that applicants maybe shouldn't stress too much about, and is probably a better thing, like the other guy said, to avoid in fellowship conversations, just in case there is an issue on the other side.
I love your guys' answers. I mean, this definitely comes up, and so it's something that I think applicants are maybe not aware of until they get into interviews. So it's good to consider ahead of time. Is there a specific geographic location? How do you want to handle that in the interviews? One of the things I want to ask about here is, currently we're doing a match, and there's some real benefits to that, but there's also some downsides from both sides. What do you guys think? Should we continue with the current match program, or are there ways in which you think we could improve it as compared to how it currently exists? What do you think, Andy?
Well, I think overall, I think the match is great and equitable. One of the interesting changes to the residency match this year has been the signaling process, which y'all may be aware of, but essentially med students can signal up to 30 residency programs, orthopedic residency programs, that says, hey, I'm particularly interested in that program. And the intention of the signaling process is to cut down on the number of interviews essentially that each of the applicants end up going toward, because it was getting sort of out of hand where applicants were applying to 80, 100 different programs, and just sort of cutting that down to the ones they're actually interested in. And it was a attempt at making the whole process a little bit more fair and equitable for everyone. Whether that makes its way into the fellowship match, I'm not sure, and I don't know how that would kind of manifest, particularly in the shoulder elbow fellowship match where it's already such a small field. But it would be interesting to see in 5 years or so if that kind of new process stays, I suppose, in the orthopedic residency match, but then also makes its way into fellowship.
What do you think, Mike? I mean, is the match as it currently stands? You like the process? You don't like the process? How do you think it's going to change in the future?
I like it. I guess if the alternative was to go back to something where it was, you come interview and we tell a couple people you have 24 hours to accept the offer, it's hard because then you have to sort of hedge your bets. You have to think, well, gosh, there's this other program I'm not going to interview for another 3 weeks. Do I really want to take this offer? What if I don't even get accepted at the other program? So it's too open-ended for too tight of a system. It's too tight of an employment system where you really need the numbers to fill themselves out. So I think the match could be tweaked with things like signaling, depending on the subspecialty and maybe the size of the subspecialty and the number of programs, number of spots. But I can't imagine going back to truly sort of unmatched unless something got so small, like if there were a field that, I don't know, only had 10 spots and 10 people applied, then it might work without a match. But I think the numbers are such that it has to be sort of tightly controlled enough to make sure as many people get spots as possible and as many spots get filled as possible.
What do you think, Ryan? I mean, you're the one who's most recently been through the process. Did you think it functioned well? Do you think there's ways we could improve it? Should we have signals? Certainly, it's a smaller field, maybe not as necessary, hard to tell.
I don't have anything brilliant to add. I think Andy and Mike made good points. I think that I obviously haven't seen it from the other side, but having recently gone through it as an applicant, I think it went pretty smoothly. And I know that the ASES and Dr. Levine had made some significant efforts in the past, 4 or 5 years to try to improve the match process specifically for shoulder and elbow. And I think it functions pretty smoothly. I think part of that process was trying to avoid some of the kind of the backdoor conversations, but those happen regardless. I think that the signaling thing is a nice way for applicants to kind of have, I guess, somewhat of a analogous process and be able to indicate interest in kind of a controlled fashion. But I think overall the match, given the kind of the considerations for how many applicants there are and how the process works, I think is at least for the time being is a good way of doing it.
Let me ask you guys, one popular thing that's really occurring now, and I think I've seen an increase in this in the last 5 years, is applicants pursuing 2 fellowships, be it sports and shoulder, shoulder and trauma, shoulder and hand, or whatever fellowships it might be. What do you guys think about this? And do you think it's necessary? Do you think it's just trying to increase our attractability in the job market to have that special niche that no one else has? What do you think about traveling fellowships, not through the societies, but going abroad, spending time, in France or Germany or Australia or wherever you might like to go before starting your actual job? Ryan, let's go right back to you. What are your thoughts on this? Obviously, you picked your fellowship, but did you give consideration to 2? And what do you think about 2 fellowships?
I think it really depends on what the applicant wants to do. Through the process of my residency training, I was always interested in upper extremities. So I considered hand and kind of peripheral nerve surgery for a little while and thought maybe I would want to do kind of a, comprehensive finger to shoulder tip type of experience. But some advice I got from one of our hand faculty was that you really, in a year of training, you can't learn how to do that many different things really well. So I think if somebody is truly wants to be a hand surgeon and an elbow surgeon and a shoulder surgeon, then doing 2 fellowships is probably the way to do it if you really want to be proficient at all of those things. I think for anybody applying into shoulder who is thinking about a second fellowship because of, I think, kind of the old dogma that shoulder jobs are hard to find, or at least, purely shoulder elbow jobs are hard to find. While that may be true to some extent, I think that is becoming less and less common as more and more places, both academic and private, are realizing the value of truly having a shoulder and elbow fellowship trained person in their practice. So I don't think that people need to feel that they should do another fellowship because they need to have, some other skill set, or like, a side gig or other cases that they can do because they're not going to have enough shoulder things to do. I think, it's another year. People talk about potential future income loss, things like that, which may have more or less importance to people depending on their financial situation. But I think that if the reason is to get additional training for the reasons that you want to have a particular type of practice, then it's reasonable. But I don't think it's necessary, and people should definitely think about the ramifications of spending an entire additional year, being a fellow or doing training. Rachel, was there a second part to that question that I didn't address?
Nope, I think that's great. Let's turn it over to Michael. What do you think? Thoughts on 2 fellowships? Thoughts on those pesky sports fellows like myself who have an interest in shoulder and then want to do a second shoulder fellowship, or the hand to shoulder, et cetera? What are your thoughts here?
We're very welcoming these days, Rachel. It's different than it used to be. So,
Noted.
Ryan had a good point about the finances of it. From a purely mathematical standpoint, I would have to imagine it does not pay itself off to do a second fellowship. But honestly, I would say I would probably ignore that statement, because if that's something that's important to you, you're so early in your career that almost becomes irrelevant, right? It's not math that you're looking at 30 years later. When you're looking at it on the front end, it will be fine. So even though the mathematics may not work out to pay off the loss of income and the year later start date, I would say ignore that. If you want to do a second fellowship, go do a second fellowship. But I think the time where it makes sense is if you're going to, you almost have to be in a referral-based system for that to work, just because, if you look at any of the subspecialties, there's enough sort of bread and butter off the street that really doesn't need surgery, that if you're seeing 2 specialties worth of bread and butter, you can't really dive into getting more specialized in either one of them, if that makes sense. I think you have to be fed in some sense by a system or by ancillary supports, each of those specialties, to be able to do either one of them at a high level. Otherwise, then you're doing both of them at a low level, in which case, what was the point?
All right. And Andy, anything to add to that?
No, I guess I would just echo, with the exclusion of the folks who are either have a very particular research or kind of academic focus, or they want to work with a very specific patient population. In general, I think you're going to be so specialized, invaluable to any group as a shoulder elbow surgeon, that you don't, like, quote unquote, need to further distinguish yourself with additional fellowships.
All right, I wanted to ask one final question, and this is not necessarily on the topic of how you choose a fellowship, but I think it's kind of in the same time period in terms of the people who are listening and what they're thinking about, which is, when do you really need to start thinking about your job? Is it desirable to have a job before the match? Is it desirable to have a job before you go to fellowship? Is it most desirable to find your job while you're in fellowship? Now, I certainly think there are merits to each, and certainly there can be specific situations, but I was hoping you guys could talk through, I think a lot of PGY4s, PGY5s are starting to get anxious, like, I need to find a job. I hear finding a job is hard. How am I going to figure out how to get a job? What advice would you give to the person who's probably spending a lot of kind of mental cycles trying to figure that out. What do you think, Andy?
A lot of the jobs don't even open up until a year or so in advance of when you'd start. So I tell our PGY4s, don't worry about it. Go through your fellowship application, get all that stuff done. Maybe during PGY5 year, middle to end of it, start thinking about that. But really, end of PGY5 and beginning of fellowship is when you should start really putting out the feelers. It's a little bit of a tough thing sometimes because you're starting fellowship and sort of asking almost right away if these mentors, like brand new mentors of yours, can help you find a place. But that's just in terms of when jobs open up, generally speaking, is the right time to do it.
What do you think, Mike Amini? I mean, is that good advice? Wait until fellowship. Should people be starting earlier?
Yeah, I think it depends on, I think kind of two different potentially competing interests, right? Is how much location matters to you, like from a personal perspective, and how much the job matters from you from a professional perspective. If location is very important and you find a good job in the location, take it, right? Because to find the right job in the right location, that's tunnel vision, right? And so if you find one, take it, even if it's before you start your fellowship. At least that's kind of generally how I would say I go about that. Now, if the jobs are more important and you're very open location-wise in terms of kinds of cities you would live in, parts of the country you would live in, then I would say, wait until fellowship for a couple of reasons. One is that jobs will open up, like was already said, closer to your start time, maybe 9-12 months in advance. Plus, your fellowship mentors, in addition to your residency mentors, are additional outlets for you to find jobs, right? They're going to know about jobs. They're going to be additional sources of reference for you. And so if the actual practice is the higher priority of those two things, wait into fellowship year. And then, after a month or two into fellowship year, you should be really doing some sort of heavy lifting in that regard. You don't want to be starting the process, springtime around now. That would be a little too late.
Now, what do you think, Ryan? I mean, I know you're still in the thick of it, trying to figure it out. Have you had thoughts here about what the right time is?
I think that the right time is very individualized for the reasons that both Mike and Andy said. It depends on, I think Mike's kind of distinguishment between location and job is right on point. And I think there's other considerations for each individual person, the type of practice they're going to be in, private versus academic. And Andy's point about timing is so true too. I mean, there's a lot of it has to do with when things are becoming available and how that overlaps with where you are in your training. I think that having been accepted to a fellowship is a very helpful talking point, because you're on your way. You will be being trained to be a shoulder and elbow surgeon. So that's I think a helpful milestone or time point to begin talking to places. But I think that is a good starting point, but that people don't necessarily need to be stressing about doing it much sooner than that, and know that things will continue to develop. And, the further along you get in residency and then into your fellowship, the more mentors you have to speak to and things like that. So I think that there's no right time that can be used as a blanket statement. It's very, very dependent on each person and what different factors that Mike and Andy brought up are kind of at play for them.
I want to thank each of you guys for coming on. I mean, this was a wealth of good advice in a place where I think it can be hard for people who are in this position to get good advice. Certainly, I feel like many of our trainees are kind of hungry for this kind of high quality advice. So I really appreciate it. I think this is going to be incredibly valuable to listeners, and hopefully it'll be something people reference for years to come as they reach this point in their professional life.
Yeah, I'd like to echo Pete. Thank you all for coming on to the podcast. This is a topic that, 99% of shoulder and elbow surgeons nowadays, they're doing fellowships, and so this is near and dear to all of us. And I would echo Pete. I think that this information is going to be incredibly valuable not only for our young listeners who are about to go through this process, who are going through this process, but also our more seasoned listeners who are recruiting the fellowship applicant and trying to figure out what the fellowship applicant needs to know in 2023 and what they want out of training moving forward. Because it really is, there's a lot of principles that will never change. You want complexity, you want volume, you want good mentorship, you may want some research, you may want, future job opportunities, but the process is changing and education is changing. And so this is really a timely topic. That is all the time we have for this podcast. Again, we want to thank our guests so much for coming on. For all of our shoulder and elbow listeners out there, please don't forget to subscribe. And for Pete Chalmers, I'm Rachel Frank, and we'll see you next time.